Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What's causing my abdominal pain when peeing? 14 potential reasons. Abdominal pain while peeing is a symptom of numerous health conditions. It could be from a urinary tract infection, UTI, or something more serious. Abdominal pain can radiate to other areas like the back and flank, sides of the torso between the ribs and hips, making it difficult to localize the pain. /r/n/r/nstefanamer, Getty Images/r/n/r/n Healthcare providers divide the abdomen into 4 quadrants. This helps localize pain and other symptoms to a specific area of the abdomen. The 4 quadrants are :r/n/r/n. A UTI is a common bacterial infection that occurs when bacteria enter the urinary tract. It typically affects the bladder but can also affect the kidneys. /r/n/r/n While common in people of any sex, females are more likely than males to develop a UTI. This is due to a shorter urethra and the closer proximity of the urethra to the anus and vagina. /r/n/r/n Symptoms of a UTI include /r/n/r/nVerywell Health acknowledges thatsex and genderare related concepts, but they are not the same. To accurately reflect our sources, this article uses terms like female, male, woman, and man as they are used in the sources.r/n/r/n. The prostate is a walnut-shaped gland in the male reproductive system. It surrounds the urethra and has sections near the rectum and bladder. /r/n/r/n Prostatitis is inflammation of the prostate gland. Prostatitis may be chronic or acute. Chronic prostatitis develops slowly over time and is believed to be caused by microorganisms other than bacteria, but the exact cause is unknown. A bacterial infection causes acute prostatitis, which occurs suddenly and is short-term. /r/n/r/n Chronic prostatitis symptoms vary from person to person but often include pain that lasts for 3 or more months. The pain can be felt in the following areas: /r/n/r/n Acute bacterial prostatitis symptoms develop suddenly and are typically quite severe. These symptoms include /r/n/r/n Chlamydia is a bacterial sexually transmitted infection, STI. It often does not cause symptoms, so someone may have it without knowing it. However, when chlamydia does cause symptoms, the presentation will vary based on a person's sex. /r/n/r/n Symptoms in women include /r/n/r/n In men, symptoms may include /r/n/r/n If the infection spreads, it can cause lower abdominal pain, fever, and nausea. /r/n/r/n Genital herpes is a common STI that infects 1 in 6 people in the United States. It is caused by the herpes simplex virus, HSV. There are 2 types of HSV. HSV-1 typically causes oral cold sores, whereas HSV-2 typically causes genital herpes. However, HSV-1 can cause genital herpes, and HSV-2 can cause cold sores. /r/n/r/n Someone can be infected with HSV and not know it. When it does cause genital herpes symptoms, they may include /r/n/r/n An early symptom of genital herpes in women is pressure or pain in the abdomen. /r/n/r/n Gonorrhea is a common STI caused by a bacterial infection. It can affect the genitals, rectum, or throat. Gonorrhea may or may not cause symptoms. /r/n/r/n Symptoms of gonorrhea in women are /r/n/r/n Symptoms of gonorrhea in men are /r/n/r/n If gonorrhea is left untreated in women, it can cause pelvic inflammatory disease, PID. This can cause lower abdominal pain. /r/n/r/n Kidney stones are small, solid, rock-like material formed inside of the kidney. A stone forms when there are high levels of certain minerals in the urine. When the kidney stone passes through the urethra, the tube that connects the kidney to the bladder, it can cause several symptoms. These symptoms include /r/n/r/n urethritis is when the urethra becomes swollen and irritated. Bacteria or viruses can cause this condition. The symptoms differ between men and women. Below are the symptoms specific to each sex. /r/n/r/n urethritis symptoms in women may include /r/n/r/n urethritis symptoms in men may include /r/n/r/n pelvic inflammatory disease, PID, is an infection of the female reproductive system, which includes the uterus, fallopian tubes, and ovaries. It is typically caused by a bacterial infection, usually an STI. /r/n/r/n PID symptoms vary widely. They may include /r/n/r/n the epididymis is a tube that connects the testicle to the vas deferens. When this tube becomes inflamed it is called epididymitis. /r/n/r/n epididymitis is most common in men ages 19 to 35. The STIs chlamydia and gonorrhea are the most common cause of the condition. /r/n/r/n the symptoms include /r/n/r/n pyelonephritis is an infection in the kidneys. It is a type of UTI that has moved up past the bladder, into the ureters, and landed in the kidneys. A bacterial or viral infection can cause pyelonephritis. /r/n/r/n symptoms of pyelonephritis include /r/n/r/n pyelonephritis can lead to serious complications like sepsis, a body-wide, potentially life-threatening response to an infection, and should be treated immediately. /r/n/r/n obstructive uropathy is a condition in which the urinary tract is blocked and urine cannot pass out of it. An enlarged prostate is the primary cause of urinary tract blockage, but other conditions can cause it as well. It tends to occur in men over 60 years of age. /r/n/r/n the symptoms of obstructive uropathy include /r/n/r/n a urethral stricture is a narrowing of the urethra. The urethra is the tube that carries urine from the bladder and out of the body. /r/n/r/n a urethral stricture can be caused by scar tissue after surgery, swelling, infection, or an injury. When urine isn't able to exit the body easily, several symptoms can result. These symptoms include /r/n/r/n bladder cancer is a type of cancer where the cells in the bladder grow uncontrollably. Most bladder cancers are urothelial carcinoma, also known as transitional cell carcinoma. Bladder cancer symptoms vary from person to person and depend on the type of cancer and its stage. The symptoms include /r/n/r/n when bladder cancer has spread beyond the bladder. It can cause additional symptoms like abdominal pain, inability to urinate, and lower back pain. /r/n/r/n endometrial cancer is a type of cancer where the cells that line the uterus, endometrium, grow uncontrollably. It is the most common type of female reproductive cancer in the United States and is more common in postmenopausal women, those whose menstrual cycle has ended, over the age of 60. /r/n/r/n a few symptoms suggest someone may have endometrial cancer. They are /r/n/r/n numerous other health conditions can cause pain while urinating. Many times, it due to irritation or inflammation. Below is a list of causes: /r/n/r/n lower abdominal pain when peeing is not normal, and a healthcare provider should be contacted for an evaluation. /r/n/r/n other symptoms that warrant a call to a provider include /r/n/r/n abdominal pain while peeing needs to be evaluated and treated by a healthcare provider. Do not attempt to treat abdominal pain at home without the help of a healthcare provider. Many of these conditions can develop serious complications if left untreated. /r/n/r/n abdominal pain while peeing will be treated based on the underlying cause. If a bacterial infection causes pain, antibiotics may be prescribed. Viral infections are not treated with antibiotics and will require supportive therapy. Antivirals may be used in case of horsefly infection. Other causes, like a urethral stricture, may need surgery. /r/n/r/n Discuss additional self-care and over-the-counter remedy options with the healthcare provider. /r/n/r/n Abdominal pain while peeing is a symptom of many different health conditions. It's important to contact a healthcare provider if you are experiencing this symptom to get evaluated and a prompt diagnosis. Treatment will depend on the underlying cause. If it is a bacterial infection, then an antibiotic will likely be prescribed. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.